Kamrimo, to respected dignitaries, our respected elders, and everyone present here. I do understand it's very hard for every one of us to stay awake after having such a wonderful lunch. However, I request your attention for a few minutes. I'll try to keep it as short as possible. Okay. Slide. Okay, I have to wait. No, I think they are. Shall I? Okay. Okay. So, for my PhD, I have worked on Rai community, and my topic is ethnohistory and identity assertions of Rai community in Sikkim. However, since today we are majorly Lepchas here, Rongkup, so I felt it is an opportunity for me to share my MPhil work that is on healthcare practices in rural Sikkim, a case study among Lepchas of Bakcha and Chozo village. I have done my MPhil under the supervision of Dr. K.R. Rama Mohan from Department of Anthropology, Sikkim University. Slides next. Okay. The concept of health is universal. Every society has its own separate way of describing and promoting good health and curing the ailment from which people suffer. The definition of health given by World Health Organization states that health as not merely the disease or absence of disease and infirmity, but complete physical, mental, and social well-being. Prominent anthropologist W.H.R. Rivers has stated that indigenous medicine practices which might seem irrational to Westerners were rational when kept in the wider context of local belief and culture. Next slide. Lepcha are the indigenous inhabitant of Sikkim Himalayan region. Traditionally, they have their own concept of health and illness that is completely directed by the belief in supernatural beings. However, with the change of time and with the influence of other communities, particularly in their traditional culture and religion, multiple changes has arrived, including in their healthcare system. So this study is imperative to have an in-depth understanding and analysis. Next slide. Okay, so the objective of this study, to study traditional healthcare practices among the Lepchas of Bakcha and Chozo village, to explore the magical religious practices in relation to health and illness, to assess the modern healthcare practices among the villagers. This research is based on intensive fieldwork in Bakcha and Chozo village, which is in North and West Sikkim, respectively, and both primary and secondary sources were used for this research work. Secondary data were collected from various books, articles, and journals. Anthropological methods like participant observation, case study, interview schedule were used for this research work, and qualitative data were collected from the field areas. Sample includes healthcare practitioners, both traditional and modern, from these two villages. So when we talk about the concept of health and illness among the Lepchas, it is entirely guided by the belief in supernatural beings that exist in this world, the good spirit or Rum and Mung. There are also other semi-divine beings known as Lungzi, who also resides in various natural environment and objects. And it is believed that any disregard are shown to them or any disrespect are shown to them, then the person or the whole village have to face the wrath of these supernatural beings. And to maintain that balance between the human world and this supernatural realms, our shamans like Mun, Bungting, Padim, they plays a very important role. So this is a picture of Kalu Aju. He is from Chozo and is one of the most senior Bungting of this area. Next. He is, I personally call him as Aju Sangye. He is from Bakchia village, Phensong. So beside our Bungting, we also have, like, we Lepcha have a huge, source of knowledge on medicinal plants, and that is also the reason, like J.T. Hooker, when he visited Sikkim and other eastern Himalayan regions somewhere around late 1840s and early 1850s, he complimented Lepchas as born botanist and pure naturalist. And he is Namchiring Lepcha from Chozo, a herbalist. Next slide. Okay, so he is Ren Nidup Chiring Lepcha from Chozo. Okay, so Tamsang 2004 has also mentioned more than 40, okay, so no, it's 80 medicinal plants in his work. And next slide, please. Okay, so these are a few of the medicinal plants that were collected, and these are used by the Lepchas of Chozo and Bakchia villages. This first one is Runkin. It is used for high fever. And the second is Selek, used for stomach pain and evil eyes. This is Namnongmuk. It is used for healing wounds and nose bleeding. Shambin for stomach pain. Okay, and this is Tignyel for controlling nose bleeding and bleeding in case of some injury, and even to treat skin diseases. Nokrul pot for stomach disorder and vomiting control. Perfect for diabetes. Hing for stomach pain and vomiting control. Next slide. Okay. So this is Peju Kung. That is for a body ache, and Ruklop for a fever. This is Tingbum Chilok, used for headache, toothache, and sinusitis. And Pugukung for throat pain and typhoid. This is Tingsingmuk for wound, and Sugimuk for throat pain. This is Sugorsa Namnongmuk. It is for Nging, that is food poisoning, and even Ribum is also for food poisoning. Then Tungtok, this is for throat pain and body ache, and Tujormuk for eye-related issues. This Sungtuk is also for food poisoning, Nging, and Kuzukungsa Tingib, this is for measles. So beside various medicinal plants, Lepchas also use various animal products for medicine, and the above is Numbuk Tuluk. This is for body swelling and tuberculosis. The second one is Sufyuxa Arong for food poisoning. So there are also other products like deer skin, monkey meat, fox meat, bear appendix. These are all used for medicine. So in terms of modern healthcare, all the villagers of these two areas are receiving healthcare facilities from primary health center and primary health sub-health center. And this is a picture of staffs from primary health center, Phensong. So this is a picture of newborn baby with his mother at primary sub-health center, Thingling, which provides healthcare facilities to Chozo village. So ICDS also plays an important role by providing nutritional and educational need to both children and mothers. So through all this research, it is found that there is an urgent need for the preservation of indigenous knowledge of medicinal plant that exists among the Lepchas, and it is a heritage of Lepcha community, and majority of the knowledge is held by the elder generation, and it is found that there is a gap between the knowledge sharing among the elders and the younger generation. And it is also found that the proximity to capital, that also influence in the getting better healthcare facilities and also the awareness about the health. And in this case, Bakchia village are more benefiting as compared to Chozo village because it is much more far from the capital. And a problem of alcoholism is present in both this village, and I think it is also a duty of the community, younger generation, to bring awareness in our society about it. And the case of epilepsy is high in Chozo village, and people have their own cultural explanation to it, that why it is present there. And for food poisoning, people in both the area fully rely on traditional medical system, and they believe that modern healthcare system is incapable of treating this problem. And in nutshell, we can say that the Lepchas of both Bakchia and Chozo village mix both traditional and modern healthcare practices according to the nature of health issue and degree of health problem, and according to the convenience and affordability. Next slide. Okay, these are some of the references I used. Next. Okay, Tokchia Gap.